Hi everyone, I'm Lindsay Farrier from CafeMom. You might remember a few weeks ago we brought you a story about the new healthcare law, and it was pretty straightforward. We told you what it's doing now, what it's going to be doing a couple of years down the road from now, and where you can go to get more information. Now the response to that story has been very mixed. Some of you are happy to have that information, others of you are not happy with this new law at all, and judging from your comments that I've got here, it's really not hard to understand why. One of you wrote, "My rates have more than doubled since Obama took office." Another person wrote, "My family can't afford health insurance because of the higher premiums." And a third person wrote, "Doctors in our small towns are disappearing." Obviously, there are two very different sides to this story. And so for those of you who are opposed to the new health care law, we wanted to hear what an expert has to say to address your concerns. That's why we came here to Washington, D.C. today to talk to a man named Tom Miller. He literally wrote the book on the subject. He calls it Why Obamacare is Wrong for America. Let's hear what he has to say.
So it's a grand experiment, and what they're doing is they're experimenting with our health care.
Tom Miller is a scholar at the conservative think tank American Enterprise Institute, where he specializes in health policy and regulation. He says women should be skeptical of the Obama administration's promises of free contraception and free preventive health care.
A lot of these are very narrow, targeted benefits, which look to be free, but they still cost something, and either they're paid for in taxes, they're paid for by their employers, or it's priced into the insurance somewhere else, or there's another restriction on the care that they would have liked to get because you have to accommodate that. But you can always do these one-offs where it looks like something's wonderful if that's all you look at. You have to look at the entire picture.
The entire picture, he says, is a flawed new healthcare system that costs too much money, discourages employers from expanding their businesses and creating more jobs, and gives government too much control over our healthcare options.
We have to get this back into the hands of patients and consumers and those who have a direct stake in helping them, physicians and other healthcare providers. And the more we move away from that by thinking if we can just hide the numbers somewhere else through taxes, borrowing, or regulations, which are taxes by means of just coercing people to do things you won't pay for, we get further away from finding the real solutions we need in healthcare.
Miller says if this new law is not repealed or overturned by the Supreme Court, Americans are going to see changes in their healthcare options over the next 2 years that they definitely won't like.
They'll be finding out that what they relied on in the past is less secure. They're not going to be as certain as to whether that coverage they were getting from their employer may be on the same terms. They'll find out that more and more, as much as they may have been a little disappointed that costs were going up, or maybe their employer didn't give them exactly what they wanted, or they couldn't find everything in the individual market, it's going to be a less responsive environment. They're not going to have the lobbyists or the interests in Washington to get their voice heard, but the rest of the folks will run the system for their own benefit. And it will make the healthcare system less sustainable, less affordable, and less secure than it was before.
So now we've heard from people who are for the new health care law, and you just heard from someone who's opposed to it. We want to know now what you think about the new law. Leave us a comment. Let us know. For CafeMom, I'm Lindsay Farrier.